If you pick up a textbook or look online, you'll find simple definitions of complex problems. For instance, we could look up cancer and find two broad groups. Benign cancer is less aggressive and relatively easy to treat. Malignant cancer is aggressive and difficult to treat. But we all know it's much more complex than that. There are hundreds of benign cancers and hundreds of malignant ones. So if you pick up a textbook and look up elbow dysplasia, it should be no surprise to find neat and tidy definitions. According to the textbook, there are 4 types of elbow dysplasia. 2 involve loose fragments inside the joint, 1 involves flaking of cartilage, and the 4th type involves a problem of abnormal fit. So let's imagine we have a diagnosis of one of those 4 problems. We'll say a CT scan showed a small loose fragment. Now at first glance it looks like we have a simple choice. We can leave the fragment alone or we can remove it. So you do your research. Which is better? Leaving it alone or removing it? That research means comparing your dog with other dogs. And what's the likelihood you'll find 10 dogs, 100 dogs or 1,000 dogs with the same problem as yours? The answer to this question depends on what you've left behind. We've removed a focus of pain, but this is not a normal elbow. So how abnormal is what we've left behind? Well, that has nothing to do with the fragment and everything to do with our starting point. This 3x3 Rubik's Cube is much simpler than a dog's elbow, and it has 43 quintillion different combinations. Unlike cancer, complex problems will always be harder to solve than simple problems. So if your dog has elbow dysplasia, their problem's as unique as they are. And that's why you should never find agreement about what works best for a group of dogs. It's about what works best for each individual. Now, if you're not a fan of puzzles, but you'd like help making choices, don't worry. There's another way to understand elbow dysplasia. Instead of a puzzle, we can compare an elbow to a foot in a shoe. In this analogy, the foot's skin represents cartilage. So when we're children, we need frequent shoe changes to protect our growing feet. A growing puppy with elbow dysplasia is like an adolescent whose feet are too big for their shoes. In puppies, it's very important to identify and treat individuals who are at risk of developing severe cartilage wear. The other name for cartilage wear is arthritis. Yes, you heard correctly. Untreated elbow dysplasia commonly causes severe arthritis even in puppies. For them, our primary goal is future-proofing. Now we have the same goal for adults, but for them we're in less of a hurry. In our shoe analogy, some adults might have 1 or 2 blistered toes. Most of their foot's comfortable, but one corner's causing pain. That's the same as our single loose puzzle piece. Now the reason for the blister is a tight shoe. In an elbow, that tight shoe effect is termed incongruity. In our worst case shoe scenario, incongruity is severe and the whole foot is covered in blisters. And if you think of it in these terms, you can see why pain gets better with rest and recurs with high impact exercise. That's precisely what we'd expect if we had blisters on our feet. Improvement with rest or painkillers doesn't mean our blisters have healed and our feet are back to normal. If our shoes didn't fit, we'd expect our pain to return, which unfortunately is just what we'd expect for a dog with elbow dysplasia. So what do you do next if your dog has elbow dysplasia? You should have a long list of questions. On top of that list, you should have the question, how do I know if my dog's suffering? And if you follow us on YouTube, you'll find that's the subject of our next guide.